Hi everyone, my name is Dr. Samir Sinha and I am the Director of Geriatrics for Mount Sinai and the University Health Network Hospitals here in Toronto. And I was asked to address the question today, could the elderly bankrupt Canada? Now that's a rather polemical question, but I have an interesting answer for you. If you look at our society today, the elderly number, about 14% of our overall population, are composed of people who are 65 and older. But I'll tell you this, that population is going to double over the next 20 years, and the population that's 85 and older is going to quadruple. So everyone's now thinking, wow, these people, they're going to be requiring more and more health services, and by the nature of them just being old and needing health services, they're going to bankrupt the system. So, okay, that's an interesting point to start at, but let's look at this a little bit further. First of all, when you look at the older adult population, while they represent 14% of the current Canadian population, they do represent a group that utilizes services much higher than any other segment of the population. They use 21% of the emergency room visits, they represent 39% of the inpatient admissions here, and they actually represent 60% of the actual bed days. So when you actually look at acute care costs within our healthcare system, they actually account for 60% of our healthcare spending in hospitals in our country. And when you look at healthcare spending in general across the country, older people represent almost half of every healthcare dollar spent in our country, and they only represent 14% of the current population. And again, just to repeat, they're going to double over the next 20 years. So by just doing the math and understanding that this is a segment that uses a lot of healthcare resources, you could make the argument that they're going to bankrupt the system. But I like to think of it in a more positive way and saying, how do we actually look at this differently? And this is why I say it, because I think the peak point that I want you to leave with today is that the patients have changed and the system hasn't. And that's why I say if we keep doing what we're doing today, certainly the elderly will bankrupt Canada, but not through their fault, through the fault of our own. I think that as smart healthcare practitioners, we have to understand what are the needs of our elderly patients. Now keep in mind that not all elderly patients are people who just hang out in hospitals every day. We actually know that over half of older patients are actually living quite well. They're living independently, they're leading independent lives, they don't actually need a lot of healthcare services. But there's actually a small cohort, about 20% of our older population, that actually uses 80% of our healthcare resources. And why is that? Well, first of all, we have a system that wasn't designed for the current patients that are using our system the most. When our systems of healthcare were designed, they were designed at a time when people didn't live as long as they do today. They didn't have as much chronic disease because they weren't living as long to acquire as many chronic illnesses, and they didn't have as much functional impairments, so problems with doing their daily activity, their daily activities of daily living, such as walking, bathing, toileting, very basic things. But we know now that there's that small segment of the population that's actually burdened by what I like to call social frailty, not living as socially connected society, not having their family members maybe living in the same house or in the same community anymore, not having maybe having many multiple medical conditions, and also maybe having some problems with function. That's the segment of the population that's coming to our hospital, and they characterize those people who use the majority of our healthcare services. So I think we can do things in a much smarter way, and we're doing those sorts of things. If you come by my hospitals here, Mount Sinai, UHN, you can see how we're actually implementing something called the ACE strategy, the Acute Care for Elders strategy. It's a strategy that's simply based about being integrated and comprehensive, and it's proactive. So we try and identify those patients, that small 20%, right at the point that they arrive in our emergency departments. We then say, what are their needs? Are they characterized by functional issues? Do they have problems with polymorbidity, multiple chronic issues? Do they have social issues as well that we need to help address to help them return home independently? And we work in a proactive manner, try and manage that in a continuum of care that not only spans across the hospital in our emergency departments, inpatient, outpatient settings, but even by providing supports for people in their own homes to make sure they don't even have to come to hospitals in the first place. It's about designing a smart system to actually recognize the needs of the patients who are here and now today, who are present, and what are their current needs. And it's by matching their needs, by matching with a system that's smart, that we can actually administer systems that actually decrease length of stay, decrease ALC, decrease all those things that are burdening and costing our health system money when you have a mismatched system with a mismatched population. So it's understanding the patients have changed, the system hasn't, but here at Mount Sinai and UHN, we're changing the system, and I invite you to take a look at it.